going to have Dr. Ellen Dean Davis. Are there any questions now? Can we tell? I don't know how to tell. Okay. So my feeling about ergonomic chairs are that the children are so many different heights. If you sit in a chair where you're sitting so that your hips are at 90, your feet are at 90, so you're planted on the ground. I am not that interested in the back of the chair. You can put a pillow towards the bottom to sort of push you forward, but I would like to see some active muscle action in sitting up. And so that's how I like to do it. And I know they can't do it all day, but at least if they do it for part of the day, that's going to give them muscles they need, and it's going to keep them from getting back pain, which we're seeing a lot of this year. Anyway, come on down.
All right. Barbara, thank you so much for having me. My name is Ellen Dean Davis. I'm another pediatric orthopedic surgeon in the area. I feel like I'm going to be judged for my posture up here, so I'm going to stand up very straight and awkward. So I'm going to talk a little bit about, now that we're back in sports, how to stay there and how to keep kids safe, both from a avoidance of COVID standpoint as well as avoidance of injury standpoint. And I'll probably talk for about 20, 25 minutes. And unfortunately, nobody wants to pay me for anything, so I have nothing to disclose. And so in terms of what we're going to talk about, I've broken this down into three sections. One is, if you've had COVID, what are the specific recommendations to go back to playing sports? And what do you have to do to kind of get cleared? The second part is going to just be mitigating risk when going back to sports in terms of avoiding kind of situations where COVID could be spread and basically shut down sports again. And then kind of the bulk of it more is kids that are basically getting back into sports after being pretty sedentary for a year, how to keep them from getting injured, some strategies. And there will be some crossover in terms of what Barbara said as well, but I think repetition is good here as well. So when looking at this stuff, there are some specific recommendations from the American Academy of Pediatrics. There are some specific recommendations from the CDC and the American Academy of Sports Medicine. But a lot of the information that I was able to garnish was kind of like these expert opinions from major institutions like CHOP and Harvard and things. And that's just because the data isn't there yet, as this is a constantly evolving situation. So we're kind of doing our best to stay current with the times, but obviously acknowledging that things, this is a very fluid situation. So the first thing is, you had COVID, now what? How do I get back into sports? And really it depends on how bad you had it. So it's been broken down, and this is by American Academy of Pediatrics. It's been broken down into three sections. It's basically mild, moderate, and severe. And they're defining mild as either asymptomatic or less than 4 days of fever, and symptoms meaning like the lethargy and myalgias. Moderate is being more than 4 days of fever and more than a week of myalgias or any type of hospitalization that does not involve the ICU. And then the severe is the inflammatory syndromes and any ICU admission or any intubation. And so we're worried about, there has, the big concern here is that is there a myocarditis that's developed that can be even lethal. And it originally was a bit higher than this, but now looking at the risks, the numbers are somewhere around anywhere between about 0.5 and 3%. And these recommendations that American Academy of Pediatrics has put out, it really is applicable to kids over 12. And that's really because they're participating in sports at a higher level. It's more intense, more competitive, and just like the volume of time is more. And the theory is that younger kids will self-limit. And so for the asymptomatic cases or the mild cases, you have to be, it's kind of the same thing as some of the quarantine stuff. You have to be 10 days without symptoms and 10 days after a positive test before you're even considered to go back. And then even at that, you do have to have a clearance by the pediatrician. And they say that this can be a telemedicine visit, like a virtual visit if you want. And you're really looking at the American Heart Association's 14-element screening and looking for any type of chest pain and kind of out of proportion shortness of breath when returning to sport, or any palpitations or syncope. And this is just an example of the screening. So the recommendation really it does rely on some physical examinations, like listening for a murmur and like taking the blood pressure and things like that. But really, when you're talking about the mild cases, you're really looking more at the symptoms associated with it. Now, once you start getting into moderate, meaning more than 4 days of fever, more than a week of that myalgias or other symptoms, you still need your 10 days without symptoms. You need your 10 days after the positive test. You got to go to the pediatrician in person, and they're also recommending an EKG be performed in addition to the regular screening exam before clearing a patient back to sports. That's what the recommendation has been. And then the severe, kind of the ICU and intubation, really they're saying anywhere from 3 to 6 months, and you got to go see a cardiologist and get cleared, which probably means EKG, echo, and the full workup. And so those are pretty hard and fast criteria that have come up, and that's some of the stuff that I found in my research that was like a very strong black and white recommendation. And so we're going to kind of look into how to mitigate risk now going forward, because we were out of sports for so long, kids are now back in, so we're sort of back in close quarters, etc. And so how do we keep kids from passing COVID on, contracting COVID? So we want to keep them playing. And some of this stuff is like the common sense stuff that we've all been doing for the past couple of years, but we kind of need to be reminded of it as we're getting maybe a little bit more lax. And so we're going to talk a little bit about masking and just some other kind of common sense applications for this. So the only thing that is sort of really solid on this is that there aren't any recommendations for pre-participation testing. So, if you want to go back to playing soccer or football or whatever, you don't have to have a positive COVID or a negative COVID test to be able to go back. So there are certain sports and certain situations that children can be put in when returning to sports that are going to be a little bit higher risk than others. And some of this is just kind of common sense and makes sense. So indoor sports, you're going to be more at risk for outdoor sports for contracting COVID. The type of sport matters, meaning like the number of players, obviously fewer number of players has less risk. Players that are spaced out far have less risk. And then how often kids are in contact, or in close vicinity to each other will have less risk. So for example, like tennis would be a very low risk because you're outside, there's only 2 players, they're far apart, and there's really no contact. Whereas, something like basketball would be a higher risk because you're indoor, there's a bunch of players, and you're constantly knocking into each other. And so there have been, even with the outdoor sports, or really indoor as well, there have been very low on-field transmission rates, and the rates that we seem to see are the off-field transmission rates, meaning like the times that the kids are doing like team meals and transportation and riding in buses and things like that. So it's kind of some of the stuff you don't think about. You're all hyped up after a practice or a game, and you go do all this stuff, and you still need to kind of be mindful that we're trying to stay in sports by remaining COVID-free. So, masking is tough. And these recommendations come from, almost a year ago. So it's a little, things are obviously, like we said, they're evolving, they're a little bit fluid. But the recommendation at that point, and I think they make sense, is that all coaches, any officials, any spectators need to be masked, whether or not you're vaccinated, whether or not you're indoors or outdoors. And you can see kind of by these pictures here that when you have these like screaming fans and screaming coaches, it's like you're just showering respiratory droplets everywhere. And so although it may be uncomfortable and people are like, over it and sick of it, this is probably like a very reasonable time to mask, because it's such a high risk kind of activity, being like a spectator or a coach with this. It's also recommended to mask in the locker rooms, on the sidelines, in any type of like bus transportation, or anytime kids are traveling together in close quarters. There are some recommendations for who doesn't need a mask. So kids who are playing outdoor sports, so like if kids are playing football now, they don't need a mask. Kids playing soccer, they don't need a mask. They're really still, and that's pretty much what we're seeing now anyways. There still is the recommendation for indoor sport masking for like basketball and things. I don't know if we're actually going to really see that come to fruition as basketball season is starting up, but that is the recommendation. There are only some indoor sports that they recommend to not mask, and that's really just because of things like choking risks, and you don't want it to get in your face when you're like tumbling and cheering and things like that, or wrestling, where it could pose some type of choking hazard. And then obviously with swimming, there's now, so kind of moving on to sort of the third arm of the talk is that, like how Barbara said, you've been out of the game for a year and a half, you've been kind of on the couch, you haven't been doing a whole lot. How can we get you back safely without getting injured? And Barbara talked about some of the tightness, and so yeah, people have been balled up for about a year or so, and so that you get contractures of everything. We're seeing hip flexion contractures, hamstring contractures, Achilles contractures, and everything and all this tightness leads to various injuries. We see all these apophyseal avulsion fractures, we're seeing stress fractures, and then just general muscle aches and pains and back pain and neck pain and things. And it all is just attributable to sedentary lifestyle for a little while. And even just anecdotally, now that football and soccer returned, maybe 2 months ago, I've seen more ACL tears in the last 6 weeks or so than I have in a year plus. And I think I hypothesize, it's not like they're just coming my way now, I hypothesize that there's just a ton more out there because of deconditioning leading to increased injury. And I think I'm also hearing that too from some of like the representatives from some of the implant companies who see all of the different surgeons. They're seeing everybody's got a bump in their volume for a lot of these operative injuries. And then that is also probably worsened by the fact that there has been an increase in obesity. There's more weight gain over the course of the last year and a half, even a 3% increase in the obesity rate. So, in their minds, they're going to go from this over the last year, and they think that this is like their next move, They think that they're superstars, like in their own minds. And so we have to like dial them back a little bit and tell them like, pump the brakes, we got to get you back in safely. And so there are some pretty solid strategies to avoid injury in going back. And it's really broken down into I've broken it down into 3 categories. One is this pre-participation conditioning. And that's some of the stuff like paying attention to posture, stretching out the pecs, stretching out the hamstrings that Barbara talked about. I'll go into that just a little bit more from my end. And then the second way to avoid injury is to gradually go back. It's not a 0 to 60 situation here. And part of gradually going back is also following some guidelines on volume of participation. And then we'll also talk about some of the importance of sleep in staying injury-free. So pre-participation conditioning, really we talk about kind of 3 arms of it. One is cardiovascular, one is strength conditioning, and then one is more sports-specific conditioning. So it kind of makes sense, and it really depends on what sport you're trying to get back to, kind of where you're going to focus your efforts. So something like soccer, which is more of a cardiovascular kind of sport, you're going to work more on running. Whereas something maybe like baseball or wrestling is a little bit more strength oriented, so you're going to focus more on like weight training. And so in terms of cardiovascular, there are many different guidelines, and we talked about like the 10%, I think Barbara mentioned the 10% increase for runners per week, which means like if you ran 10 miles, pre-pandemic, if you ran 10 miles, you start out with 1 mile the first week and work your way up every week. And, I think it's not so much the exact on this, it's more about just going gradually. And so there are like several apps out there that are free, that are really good. So you can do like None to Run or Couch to 5K, and start slow and ramp up is really the key here. And there are like a million different ways to do that. I just find that these things are kind of helpful, and kids like apps. So, in terms of strength training, this is what kids think they're going to go out and do. They think they're like, the next Olympic weightlifter, especially kind of like the adolescent boys. But really, you start with low weights. So you start on kind of this end of the weight rack and sort of work your way up. So low weights and high repetitions. So you got to kind of tell them, like, you have to, especially these adolescent boys, you have to tell them, like, swallow your pride a little bit. Start with like the 10-pound weights and lift it 20 times, and then work yourself up to the 40-pound weights and lift it 5 times or whatever. So it's low weight, high reps, transitioning to higher weight, lower reps. And then I think the importance of core strengthening cannot be overemphasized when returning to sports. And this really applies across the board. It doesn't matter what sport you're doing, no matter what activity you're doing. If you're going to pick one thing to do, whether it's cardiovascular strength or sports specific, just do your core, because it's what is going to give you control of everything else. It controls what's going to happen around your hip girdle. It's going to control what happens around your knees. It's going to control what happens around your shoulders, etc. And again, there are, like, if you type in core strengthening or ab work into a Google search engine, you're going to have like a million of different exercises or YouTube videos that you can direct kids to that are just really easy. And so I would say, I would submit that if you're going to do one thing, do core. That'll keep you healthy. The other arm of pre-participation conditioning is starting to think about what's specific to my sport. And so that, again, it's about a gradual progression, and it really depends on the sport you're doing, obviously. And so we can't really sit here and detail out every single sport, but in general, it should be kind of like backyard exercises, non-contact, technical skill type of work, then working your way into light contact in practices, and then starting to do scrimmage within your own team before going to scrimmage outside of your own team, and then into full contact competitive play. So it really should kind of follow that progression. And so this gradual return to activities, obviously we talked a little bit about it before, it's more important in the pre-adolescent and adolescents versus the like 7 or 8 year olds who are going to kind of self-limit anyways. And so, there are a few things that cannot be overemphasized, and especially in terms of parents and coaches kind of monitoring this stuff. I think that this is very important. So warming up. When you say warm up, this is like what it means to a lot of kids. It's like catching up with your buddies and like hanging out, maybe tying your shoes. It really should be increasing your heart rate, getting your muscles warm, and then stretching. Again, when I say stretch, when I even take my own kids to their sporting events, they're stretching, but they're kind of like getting caught up on the day's events and maybe like tucking their toes and things. So you actually have to have a little bit more of an organized warm up and stretching routine rather than just going right into full-fledged play, because we do see a lot more injuries in kids who really don't do that stuff, which I think Barbara alluded to as well. And so, like, for a general guideline, that process should be probably 10 to 15 minutes, which is a good chunk of like maybe an hour practice, but it is important. And then I will oftentimes tell people, kids and their parents, that if your coach isn't going to do it, and if this hasn't been your experience with this team, then you got to get there 10 minutes or so early and kind of start doing it on your own. And, you know, we're talking about getting back in, and kids are so excited to get back into sports, which we're very excited about too, but we got to also kind of make sure that they dial it back and just don't overdo it right out of the gates. So there are some very specific volume participation guidelines, and this doesn't really even have anything to do with going back after COVID. This is like just general life for these kids. So this will be true, you know, this was true pre-pandemic, it's going to be true in another couple of years. And we see most injuries, they're either going to be traumatic or overuse, and there is some crossover, particularly in gymnastics and basketball and soccer. But you can see the overuse injuries tend to be the sports that we see that kids are doing like more hours per week and higher volume. And so one of the, or really, there are only certain modifiable risk factors for preventing injury. Like, we can't prevent the 130-pound freshman having his ACL torn because the 250-pound like senior lineman, you know, collides with him or tackles him. There's certain things that we can't prevent, but there are some things that we can prevent. And really, our guidelines for preventing these injuries revolve around volume of play. So our current recommendations are to limit the volume of participation, and we'll talk about what that exactly means. Delay sport specialization, which isn't as, it doesn't pertain as much to this talk, so we're not going to really talk about that. And then getting adequate sleep as well. And so when we talk about how much is too much of a good thing, so our recommendations say that you should not be participating in more hours per week than age in years, and that goes up to 16 hours per week. So these 9-year-old gymnasts that I see coming into the office who are doing like 3 hours, 6 days a week, and they have like, you know, a stress fracture of their foot, you know, it's because you're just overdoing it. And so it's, you know, when we tell kids and parents this, it's often met with like total shock and surprise. But this is based in science, it's based in data to prevent injury. And this is where we actually really need a lot of help from pediatricians and coaches to kind of back them up on this. And so also we're talking about, when we talk about volume participation, we talk about no more than hours per age per week, but also that there should be at least 2 days of rest per week. And there should only be, kids should only really be playing on one team at a time. So in my experience, we're seeing a lot of kids who are like the good kids, the talented kids are getting calls from like multiple teams, can you, to fill in. But they really shouldn't be doing that because they're just increasing their overall volume. And we see those kids who were once like the stars are now starting to fall behind because they're then getting sidelined with injuries. And then it's also really important to have time away from organized sport. That means time for like just regular kid play. And so this is a really good resource that I like. It's available online, it's free. It's the Sports Trauma and Overuse Prevention, which is Stop Sports Injuries. And it's like a nonprofit, and it can be accessed. There's specific things for like healthcare providers, specific things for parents and coaches, and then specific things for kids itself. And I pulled out and these are all like printable PDFs, which makes it really nice as well. I pulled this one off for baseball injuries just to kind of highlight it. They show like how to, I don't know if you can really see this that well, but they show how to run bases and slide, you know, in the appropriate way, and how to like gradually get up to speed to be able to do that. And it also does things like shows pitch counts which are really important in terms of avoiding, especially elbow and shoulder injuries in young kids that are pitching a whole bunch. So it's just like a really good concrete resource that can be utilized. And they make also like great handouts as well. So we kind of talked about some of the volume of participation. The other thing that has been founded in science to help prevent injury is sleep. So which is like a little bit counterintuitive, saying like, well, kids like basically like sat on the couch and slept for a year and a half. But it is something to, now we got to just get back to like normal life, right? And so sleep recommendations are what they are. And so kids 3 to 5 should get 10 to 13 hours of sleep per 24 hours. That includes their nap time at daycare or whatever. And then kids 6 to 12 should be getting 9 to 12 hours of sleep. And it's been shown also that kids who are sleeping, particularly high school kids that are sleeping less than 6 hours per night, are more likely to suffer an injury the following day. And kids who are getting less than 8 hours of sleep are 1.7 times more likely to be injured compared to their cohorts that are sleeping more than 8 hours. So I think that's like pretty telling there that you got to get your sleep. So, in summary, there are very specific recommendations for kids who have had COVID and want to go back to sports. And that's very algorithmic and sort of easy. Then there are some precautions, and these are evolving to actually prevent the spread of COVID when returning to sports. And a lot of this is stuff we've been doing, but maybe you're fatiguing on a little bit, and a lot of it also is just common sense. And then the third, is that we want these kids, we're so excited that they're back, we want them to stay back. And so that really starts with gradual return, pre-participation conditioning, don't overdo it, and get enough sleep.